In the first segment that introduced you to Project AIM and the resources available included an extensive review of 60 interventions that were reviewed for effectiveness, costs, and other criteria. These interventions include both individual and environmental strategies. Do you know the difference? And what does it mean if an intervention is said to be a promising practice or evidence-based? In this micro training segment, you should be able to understand and identify the difference between evidence based and promising practices, as well as individual and environmental strategies. So let's take a deeper look. Promising practices, or sometimes called best practices, are those that have the potential to effectively impact your issues, whether it is high risk drinking, mental health, or other challenges. They are usually, though not always as we'll see, things that seem to have worked elsewhere and have been replicated. But promising practices and interventions may also be untried but are based on some solid data. Sometimes there is no model for what you want to do, but by looking at promising practices, you may be able to develop your own intervention or program based on several that show promise. Once you've looked at several best practices and maybe have even connected with others about their programs, how do you decide what might work for you? First, you need to determine what the best practices you've been looking at are best practices for. Then the question is what criteria you use to identify best practices and interventions. In other words, how do you know they work? Finally, what are some of the common elements of successful practices and interventions? Elements that you can incorporate into whatever you decide to do? Are you planning a prevention program and intervention, or just one to educate and inform? Also consider any stipulations your funder may have on whether you can implement promising practices or not. Some funders allow and even encourage it because the more that promising practices are implemented and data collected, the more likely it is to move to an evidence based practice. So, by supporting promising practices, you are helping to advance the field of research. A promising practice might be an alcohol education and intervention strategy that you have developed and administered to a targeted group of students. For instance, incoming freshmen or students who are in the campus judicial system for underage drinking violations. Over the past 2 years, your campus data shows that these students have increased their knowledge of the negative impacts of alcohol, have changed their attitudes and belief about alcohol, and have not been cited or arrested for alcohol violations since their completion of the program. While your strategy has not been peer reviewed or submitted to a literature and data review, you know that for your students it's working. Could your initiative become an EBP? Sure. With some more in depth data collection, replication by others, and reviewing your strategies could become part of the state or national EBP registry. Evidence based strategies or evidence based prevention, or EBPs, refers to programs, strategies, and policies that have been rigorously tested under research conditions and found to be effective in changing behavior and attitudes. EBPs rely on empirical data rather than just anecdotal data, which is still important and useful, and part of the field of research for promising practices. Evidence based practice (EBP) is the objective, balanced, and responsible use of current research and the best available data to guide policy and program decisions. Used originally in the healthcare and social science fields, evidence based strategies focus on approaches demonstrated to be effective through empirical research rather than through anecdote or professional experience alone. An evidence based approach involves an ongoing review of research literature to determine what information is credible and what policies and practices would be most effective given the best available evidence. It also involves rigorous quality assurance and evaluation to assure that evidence based practices are replicated with fidelity and that new practices are evaluated to determine their effectiveness. Project AIM looks at 60 strategies and divides them into two categories: individual and environmental. Individual strategies are just that: strategies that aim to produce changes in one person's attitudes or behaviors related to alcohol use. Expected outcomes, in general, are that a strategy may decrease an individual's alcohol use, frequency, quantity, or blood alcohol concentration, and or alcohol-related risk-taking behaviors, reducing harmful consequences. Individual strategies can include normative education, skill building, assessment and feedback tools, or a combination. When we talk about environmental strategies, we aren't talking about hugging a tree or recycling our water bottles, though that is important. Environmental strategies and prevention are those that aim to change the alcohol use environment on the campus, community, or both, and can affect the student body as a whole, or in large subgroups such as those under 21. Most of the environmental level strategies on the Project AIM site seek to reduce alcohol availability, one of the most effective ways to decrease alcohol use and related problems. So now you should understand the difference between promising practices and evidence based strategies, as well as individual and environmental strategies. In the next micro segment training, we will take a look at the 60 strategies of Project AIM, and you will be able to identify at least two from the individual strategies and two from the environmental strategies. Thank you for joining us today. Please click the link in the video description to answer the brief evaluation.